Hi, my name is Ida Lim, and I'll be presenting on neurodegenerative diseases and Alzheimer's. About me, I'm a senior at Mounts Park Academy in Minnesota. I'm the elementary school lead for my school student ambassadorship team. I'm the founder and head of my school ceramics club, and I've taught art classes to elementary school students and nursing home residents. At For lab research, I've interned at the Hamline University for plant biology and the University of Minnesota for neuroscience. I'm currently interested in neurology and dermatology. Introduction. What are neurodegenerative diseases? These are diseases in which cells that are part of the central nervous systems stop functioning or die. These diseases progress over time, and there has yet to be a cure, and the diseases affect millions of people around the world, but most prominently of these diseases are Parkinson's and Alzheimer's disease. What is Alzheimer's disease? Alzheimer's is the most prevalent cause of dementia. It can be caused by tangles and buildup of proteins in the brain, and this leads to the death of brain cells over time. Why is this important? Roughly 6.9 million Americans over the age of 65 have Alzheimer's, and in the world, 60 to 70% of the population with dementia have Alzheimer's. While there are treatments that can help slow down brain degeneration and help with symptoms, there currently is no cure to halt the progression or cure the disease. Those in poverty also face heightened risk for Alzheimer's. The purpose of this presentation is to share information on Alzheimer's and how it develops, explain current treatment options, and share the importance of research about Alzheimer's. Potential causes of Alzheimer's: there's no direct causes known, but a combination of genes, age, and environmental factors can influence Alzheimer's. Starting with genetics, risk genes are genes which put you at a higher risk for developing a disease like Alzheimer's, but don't necessarily determine the fact that you will develop it or not. For Alzheimer's, the first discovered gene was APOE4, and for some people with this gene, it continues to be the gene with the greatest impact. 45 to 60% of the population who have Alzheimer's have this gene, but slightly different. Deterministic genes aren't the same. They determine whether or not someone will develop the disease. If you have a certain deterministic gene in Alzheimer's, the chance of getting Alzheimer's is pretty much confirmed. 1% of the Alzheimer's population has this gene, and it's mostly seen in early onset cases with symptoms showing up before the age of 65. Second, the most commonly known risk factor is age. After the age of 65, the risk doubles almost every 5 years, so the risk you had at 65 doubles by the time you're 70. This isn't a normal part of aging, however, and it's not a direct cause of Alzheimer's either. They are just closely correlated due to the fact that a large percentage of the population who has Alzheimer's also is the elderly population. In the United States, 1 in 9 adults aged 65 and older have Alzheimer's, so a pretty large percentage in just the United States alone. Environment is also a large factor. Environment and exposure to pollution. If you're living in a lot of green places and places near nature, you tend to have a reduced risk to develop Alzheimer's compared to someone who has a lot of exposure to pollution. Socialization is also really important. People who socialize more tend to have a reduced risk of Alzheimer's compared to people who don't socialize as much. Socioeconomics also plays a role in Alzheimer's as well, as I talked about earlier. People living in poverty have less access to good health care, meaning if they have conditions like diabetes and hypertension and obesity, which puts people in general at a heightened risk for developing Alzheimer's later in life, they're not getting those properly treated, and that can ultimately cause Alzheimer's. There's also less, as I said earlier, less of good health care, meaning there's lots of undiagnosed and untreated cases of Alzheimer's. Effects on the brain. Brain shrinkage is normal with aging, but it isn't normal when it occurs with the amount of neuron loss that happens in Alzheimer's. So large amounts of the brain receives damage, including loss of neural connections, loss of proper functioning, and loss of other things, which eventually leads to death of neurons. Disruption of communication and repairing the brain also occurs due to the loss of these neurons and connections. Damages in connections between neurons are often involved in memory and are located in the entorhinal cortex or the hippocampus. Later in the progression of the disease, this also happens in the cerebral cortex, and these are areas of the brain which are responsible for language, reasoning, and social behavior, which can be reflected in certain symptoms that Alzheimer's patients may have as they're losing certain functioning of these brain regions. Loss of acetylcholine, which is a neurotransmitter, also occurs when there's loss of neurons, and this can lead to loss of memory and memory decline. Spread of damages of the neurons also spreads to other parts of the brain as the progression of the disease continues, ultimately leading to the fact that Alzheimer's is fatal. Characteristics of the brain with Alzheimer's. Amyloid plaque is made by the breakdown of the protein called amyloid precursor. Beta amyloid 42 is known to be most toxic, and in a brain with Alzheimer's, high levels of this beta amyloid 42 can lead to plaques, which disrupts cell function. Another characteristic is the neurofibrillary tangle, which occurs when tau changes and they stick together instead of normally sticking to microtubules and neurons, which happens in a healthy brain. These tangles damage synaptic connections and communications between neurons. These two things, along with other characteristics, eventually leads to cell dysfunction, which is when neurons are damaged and connections are weakened. Cells start to break down, brain regions shrink, and brain atrophy ends up happening, leading to cell death and loss of brain volume. Rehabilitation treatments are treatments that help patients with Alzheimer's live their day to day as normally as they can. So this means cognitive and memory functioning when it comes to symptomatic therapies, which are designed to improve cognitive and behavioral symptoms, but they do not alter the disease on its own. Occupational therapy is a slightly different type of therapy, which is a method to allow patients to live as independently as they can. This includes advice on how to live their day to day, exercises, occasional memory training, and adjustments for their lives. Slightly different medicinal treatments that are available to help with symptoms are cholinesterase inhibitors, as I touched on earlier. When there's a loss of neurons, there's also a loss of acetylcholine, and this inhibitor helps to prevent the breakdown of acetylcholine, allowing for healthier neurons and also allowing for memory, language, and thinking skills to be preserved for longer. Anti-amyloid treatment also exists, and it's a medication for clearing the amyloid plaques I talked about earlier. Currently, there's research going on how insulin changes in the brain may relate to Alzheimer's. There's research going on about the connection of the head and the heart and how medication for heart disease may benefit Alzheimer's, how heart disease may relate to brain health and vice versa, and how lifestyle changes that affect and benefit heart health could potentially reduce the risk of Alzheimer's. This is just like a small snapshot of certain research going on, but there's clearly a lot of research that can be done for causes and cures for Alzheimer's. Conclusions. Alzheimer's is important to global health as it affects the elderly population around the world, with higher risk for people who live with health disparities. Continuing research on treatments and preventions is really important. Alzheimer's is currently a disease with no cure or way to prevent the disease. There is still a lot of progress to be made within the research of the disease, leaving room for breakthrough technologies and discoveries that could be life-changing. Here are my resources. Thank you for watching.